If you are one of the millions of people who suffer chronic, stuffy, runny nose, post-nasal drip, chronic cough, throat clearing, then I may be able to help you. I would love to talk to you today about a very innovative new procedure that has, I think, changed my practice in treating patients who have chronic, runny, stuffy nose with a lot of post-nasal drip, because I actually have an option that I can do with a simple in-office-based procedure that doesn't require any incision that might be able to help you with all these issues. So millions of Americans and many people in Texas and in Houston especially suffer with chronic allergic rhinitis. Some patients suffer with chronic rhinitis, which is inflammation of the nose that's not from allergies. But both conditions create nasal congestion, stuffy nose, a lot of mucus, constant tissues, wiping your nose. And a lot of patients also have what's called post-nasal drip, when the mucus doesn't go in the front of the nose, but it drips in the back. They keep on constantly clearing their throat. And then obviously all these people are always asking, are you sick? What's happening? So again, chronic rhinitis, inflammation of the nose. What I want to talk to you about is a procedure that's called Rhinaer. It's a procedure that was invented about 4 years ago by a great company called Erin Medical. And it's an in-office-based procedure that uses very thin wand to enter the nose without any incisions. And it will touch the swollen tissues in your nose that are called turbinates, and also the swollen back of the nose where the center for making these symptoms is. There's a nerve that is in charge of making your nose drip, making your nose swell. And so what we do is this great technology is able to turn down basically the faucet on all the mucus. I can't turn it off, unfortunately, but I can significantly turn it down. So what you should do to get evaluated for this procedure. First of all, make an appointment with me. When you come to see me, we will perform a very thorough examination of the nose to make sure you are a good candidate for this procedure. Most patients who come to see me had chronic rhinitis or inflammation of the nose for many years. They have tried in-office allergy sprays such as Flonase or Nasocort. Some tried a saline irrigation as well. Many patients tried over-the-counter antihistamines. Some patients even tried allergy shots or allergy drops. And many patients still keep having issues, or if they stop the medications, they get much worse. And so if that's your case, then please make an appointment. Once we determine that you're a good candidate for the procedure, we will schedule the procedure. We will obviously call the insurance. Some insurances cover this procedure fully. Some insurances still think that the procedure is too new and they might not be able to cover it. I have many patients who proceed to pay for this procedure as a self-pay, even though it's not ideal. I think the results are so good that patients always tell me, Dr. Suchanova, I wish I knew that this was an option earlier and I would have paid much more. The cost of the procedure as a self-pay is $2,500. Most of the Medicare plans will pay for this procedure in full. So what should you expect? When you come to see me on the day of the procedure, you can drive yourself. You don't need a driver. There is absolutely no oral medications that you have to take. This procedure takes about 15-20 minutes in the office. What I do when you come is I will place a very small amount of topical numbing gel basically in your nose. I learned how to do the procedure without any injections. So I think that really helps because many patients are scared of getting painful needles in the nose. So once I squirt a little bit of the topical numbing gel in your nose, we wait about 5 minutes. I take you to my procedure room, get to obviously meet my friend and nurse, Danielle, and we try to make the environment very calming for patients as well. So we actually put on a relaxation music. We have you on a bed, kind of a chair with a pillow and a blanket. I think all these things really help because a lot of patients are very anxious about in-office procedures. Once we have you all settled, I use camera to look inside of the nose while I'm doing the procedure. And again, I'm going to use a Rhinaer wand. It's very, very thin wand that's maybe 3.5 millimeters. And I use it to touch the swollen areas of the nose to make you breathe better. And also at the back of the nose, there is an area, a nerve, which is called posterior nasal nerve. It's basically a center at the back of the nose that's making you drain. That's giving you signals for your nose to produce all the mucus. In a lot of patients who have allergies, this obviously is very hyperreactive. And so that's why the way I describe this to patients is this procedure will calm down the nerve that's basically misbehaving. So how does it feel during the procedure? As I said, you have a topical numbing gel. There is really no pain my patients will experience. There's maybe a little bit of a pressure sensation. There may be some warmness as well, and then you're going to hear some beeping sound. But I have done this procedure extensively, and I'm very comfortable in performing it. And I think with a lot of new procedures, the experience really matters. And so I will touch you with this special one, about 7 minutes on each side, until we cover all the areas that might be causing you problems. When this is finished, we will have you sit up. We'll watch you probably for 5-10 minutes, make sure that you are doing well, make sure that your blood pressure is normal before we send you home. What to expect after the procedure? Patients have feeling that they have a little bit of a cold for about 3-4 days. Why is that? Any procedure we do in the nose, the tissue always swells before it heals. So I tell my patients, look, you're going to feel like you have a cold for a few days. The way how we're going to help it, I usually have my patients flush their nose with saline with a little bit of healing medication as well. That will really help to decrease the congestion. After about 3-4 days, the congestion is basically back to the pre-op levels. And in about 2 to 6 weeks after the procedure, the congestion actually improves dramatically because we have shrunken some of the structures that were swollen in your nose. And then the mucus also dramatically improves as well. I examine my patients first about 10 days after the procedure, make sure they're healing well. We will do what's called a debridement. It's a very simple procedure that takes maybe 2 minutes on each side. I will suction some of the mucus or healing scabs that are there just to make your recovery much more comfortable. And then I see you back in 6 weeks when you're basically healed. And I love those visits because that's where my patients tell me, Doc, this is amazing. I've been a physician for the last 13 years and I do a lot of procedures both in the OR and in the office. But I have to say that this has been one of the most rewarding to see my patients coming after a small procedure like this in the office and telling me, Doc, you changed my life. If you suffered with chronic post-nasal drip and runny nose and you basically buying Kleenexes left and right, you know what I'm talking about. And so just imagine a life without that. I mean, patients are just elated. Another aspect of the Rhinaer, even though it's not the primary one, is the decrease in the congestion. Again, usually chronic allergic rhinitis or non-allergic rhinitis, inflammation of the nose, can go hand in hand with the mucus and the nasal congestion also. So because the center that we treat with this wand not only governs the mucus, but also the general swelling of the nasal cavity, this really helps as well that with the swelling and with the breathing as well. Again, this is one of the most rewarding procedures I do. Most of my patients, my personal results, most of them report about 80 to 90% improvement in breathing and also in the post-nasal drip.